Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by Dr. Dr Mirage, Internal Medicine at MedStar Medical Group at Lafayette Center. Today, we're discussing an important topic that continues to be on everyone's minds: the difference between cold, flu, and COVID-19 symptoms. We know a vaccine is imminent, but we wanted to make sure that we're still educating our patients because we're not out of the woods yet. We also want to talk about the different sites of service that are available at MedStar Health between primary care, urgent care, and MedStar eVisit. So thank you so much for joining us today, Dr. Mirage. We really appreciate it.
Thank you, Karen. I'm really excited to be here to speak with you about this topic. It's very important during this time, especially since we're now heading into the winter months. And I know a lot of us, this is forefront in our minds. And I just want to kind of reassure people that we are here for you. We want you to reach out to us so that way you get the most appropriate and timely care. So if there's any questions, let's go ahead.
Absolutely. Yes. Thank you so much. Thank you all for joining us today. And like Dr. Mirage said, if you have questions, please ask them in the comments. Give us a like, let us know that you're watching today, and feel free to share this with your friends. We do want to make sure that we are educating as many people as possible on this very important topic. So we do have some questions already that we do want to ask you, Dr. Mirage, but before we get into those, can you share with us a little bit about yourself and your background?
So I am an internal medicine physician. I did my training at New York Presbyterian at the Weill Cornell campus in New York City. I went to medical school at Case Western Reserve University in Cleveland, Ohio, and I went to undergrad at Johns Hopkins. Prior to actually going on to medical studies, I actually did several years of research here in the DC area at Georgetown, which was a great experience and made me love this area so much.
Wonderful. Thank you. Yes, I love this area too. I've grown up here my whole life. So thank you for that. All right, well, let's get into some questions. Let's first talk about the types of viruses. What viruses cause a cold, influenza, and coronavirus?
So the cold, influenza, and coronavirus are all due to different viruses. A lot of people think that, oh, that we're just talking about the same thing. No, the cold is due to actually several viruses like rhinovirus or parainfluenza virus, which is separate than the influenza virus. Influenza virus is its own entity. There are 4 strains, 2 of which actually cause issues with us humans. So that's your influenza A and influenza B. And so a lot of times, like in 2009, when we had the H1N1 pandemic, that was a strain of the influenza virus. Coronavirus is a coronavirus. It is the severe acute respiratory syndrome coronavirus 2. So again, flu is a flu influenza virus. Corona or coronavirus or COVID-19 is due to the severe acute respiratory syndrome coronavirus 2. And the cold, it's rhinovirus, it's parainfluenza, it's RSV. There's like over 200 of them. But really, I would say the big thing is that if we are concerned about the cold, the flu, and coronavirus, we need to start speaking with a provider.
Absolutely. Thank you. So let's talk about the differences. What are the differences between the cold, the flu, and COVID-19?
So the big difference between the 3 of those is that for coronavirus, the one thing that a lot of people will notice is that it may cause a loss of taste or smell. It doesn't happen for everyone, but, sorry, my computer blinked out there for a second. But it tends to also cause by itself, for some individuals, shortness of breath. The flu and cold just in general should not cause that for people unless you have an underlying medical condition like asthma or COPD. So those are two big kind of distinguishing factors again for that. Also, the cold is something more that's kind of gradual on onset. So it's kind of like it lingers there for a couple of days. Whereas the flu, if anybody's had the flu, it hits you. You feel it like immediately. You're like, I was 2 minutes ago completely normal. And then now it's just like, I feel like I got hit by a truck.
Right.
So the flu is very abrupt in terms of its onset. Cold also really shouldn't cause you to have a lot of GI symptoms, okay? So the flu, COVID, yes, a lot of times that can accompany it. Cold, not so much. And then a lot of people do get concerned about, well, what about a fever? The cold in general really you shouldn't be having high fevers with it. The flu and COVID, that could occur. So I'd say those are some big kind of distinguishing features between the three of them.
Great, thank you. What about COVID and the flu? Like you said, you get kind of hit really hard when you have the flu. Is it similar with COVID-19? Is COVID-19 more severe than the flu?
So for some people, COVID-19 can feel very similar to the flu, and then others, they're completely asymptomatic. For a lot of individuals, depending on what your risk factors, it can be pretty severe and it can lead to a hospitalization. And so we want to make certain, again, that we start, if you're having symptoms, things like fever, sore throat, fatigue, a cough, that you start talking with your primary care provider to discuss what is going on and how we can start discussions about testing or treatment, and how we can get you help.
Great, thank you. Let's talk about, let's keep talking about COVID and flu specifically. Can you get COVID-19 and the flu at the same time?
So unfortunately, yes, you can get the flu and COVID-19 at the same time. Unfortunately, when you have one infection, it may lower your immunity and make you more susceptible to having another. So yes, you can get both. And that's why this year we are stressing flu shots, because we don't want people to have both of these things at the same time. We don't want your immunity to be weakened by something that is potentially preventable for people. And then also, in general, we don't want a lot of people having a lot of respiratory illnesses that may overburden our ERs and hospitals.
Right, thank you. Let's talk about treatment options. What are the different treatment options for COVID-19, cold, and the flu?
So regarding treatment options with the cold, it's really just kind of getting you through your symptoms. There's no kind of FDA approved medication that is out there for the cold. And so we just say, rest, hydrate. We aim things at helping out with a cough. If you're having, a sore throat, we help out with that. The flu, we have FDA approved medications for that. So those are things like Tamiflu that you can take. And in terms of COVID, it depends on where and what setting you're in, do we have treatment. So for most cases for COVID-19, if you're having mild symptoms, we again treat those symptoms. But if you're in a hospital setting, we do have other therapies aimed at that to help out with support of your breathing. Again, the big one that you've been hearing on the news is the remdesivir. We have that. There's steroid options. But again, it really depends on what setting you're in. Do you get those type of treatments?
Thank you very much. Let's talk about the difference between adults and children. How does COVID-19 and influenza affect adults and children differently?
So for children in particular, they with COVID-19 are a little bit more at risk for a condition called, oh my goodness, I'm going to say this incorrectly, multi-system inflammatory syndrome.
That's a big word.
It's a lot of verbiage right there.
Yes.
And so they're at risk for it. But the big thing, and a lot of what I've seen from our pediatrics colleagues is that yes, they are concerned about COVID-19, but they're a little bit more concerned about the flu, because unfortunately for young, healthy children, they tend to get sicker with the flu. Most kids will weather the storm with COVID-19, but the flu for some can be devastating. And again, that's why we're stressing flu shots.
Yep. What's the mortality rate of COVID-19 versus the flu?
So that is also still kind of being determined. Some of the research coming out of places like MedStar and Johns Hopkins, we suspect that there probably is about a 5 to 10-fold degree of mortality. So if we were to use the example of influenza, about 300,000 to close to 1 million people worldwide, unfortunately, die from influenza. And so if we take that and multiply it by that number, that's what we've estimated. But again, this is very evolving and changing on a daily basis.
Yep, absolutely. So when should you see a physician for COVID-19 or the flu? And do you need to see a physician when you have a cold?
So I would say this year in particular, I would stress that you really should start to reach out to a primary care provider fairly early. So that way we can talk about isolation, that way we can talk about quarantine, and then that way we can also talk about testing and treatment. A lot of times, again, as we've discussed previously, it's really hard to tell the difference between early COVID, early flu, or hey, is this just a cold kind of ramping up? So we want to have these discussions early before anything becomes a problem, especially for our patients that have higher risk conditions like asthma, diabetes, patients undergoing chemotherapy treatments. We want to make certain that we are getting them the appropriate care in a timely fashion, so that way we are not having any complications later on.
Right. And let's talk about that a little bit. When would you need to be hospitalized because of your symptoms?
So I would say anyone who would need to be hospitalized is if you are experiencing severe breathing difficulties. So this is meaning like, I feel short of breath walking, like across the room. I've actually noticed a blue tinge to my hands or my face. Or my family, or even myself, I've recognized that I'm confused. I don't really know what's going on. That's a sign that there's something imminently wrong and that we need to call 911 and seek emergent care, okay? I'd also say that anytime you are experiencing severe chest pain, that's also a time when we need to have a discussion as well.
Absolutely. Thank you. Let's pause there for just a moment. And I would like to welcome everyone who have just joined us for our Facebook Live. We are talking with Dr. Lauren Mirage, internal medicine physician with MedStar Health. And we're talking today about COVID, flu, and cold. If you're just joining us, give us a like if you have any specific questions. And we do have some from our Facebook audience, which I'll get into next. Please ask them in the comments and we'll get those questions to Dr. Mirage. So let's talk about some of these questions that are coming in from our viewers. Let's start with from Min. Thank you very much for your question. What about the difference between COVID and allergies or sinuses, I know that's also something that is top of mind for everyone. If they maybe have a sinus infection or it's just allergies, how could someone know the difference, or when perhaps having a conversation with their primary care physician could help as well?
So usually with allergies, if it is responsive to medication, so say like I have a ragweed allergy and I take a Zyrtec for it, it's going to respond to that. COVID, the flu, not really. It's not going to change. Also, a lot of the other symptoms for like an allergy infection aren't going to be there for the flu or COVID. So you're not going to have GI symptoms. You really shouldn't have, be spiking a fever with that. It should definitely not be causing you to feel short of breath. I still would say, and I would still encourage you to talk with your primary care provider about your symptoms. But I would say in that case, it would feel different and the experience would be a little bit different than that.
Thank you. That's very good advice. Let's talk about vitamin D. There's a question from Nicola. Thank you, Nicola. Is it true that your vitamin D levels play a factor in how severe COVID-19 can affect you?
So there is a lot of research right now out there regarding vitamin D levels and whether or not this plays a role in severity. Unfortunately, most of those are not panning out to say like, this is the reason why that this is happening. And again, a lot of this is very new. And so I would say that the research is ongoing regarding vitamin D levels and severity and whether or not, do you need to be supplementing more during this time? I would say we all need to get some, fresh air on occasion, wearing a mask, distancing, and making certain that we're eating a healthy diet, which would include things like calcium and vitamin D. But I wouldn't say over supplementing right now would be a good thing. I would recommend against it just because, again, I don't have any concrete, and nor has the medical community had any concrete establishment saying like, this is what is, the backbone behind this.
Great, thank you. It looks like the sun's shining right now, so getting some vitamin D always makes me feel a little bit better. There's a question from Amanda. Thank you, Amanda. How long does it take a flu shot to activate in your system?
So we traditionally have said that it takes up to at least 2 weeks for it really to take hold within your system, but there have been other studies showing that it can be within a week, showing that it is actually helping out. So again, if any take home that you get today is please get your flu shot.
Yep, absolutely. Okay, we have some more questions for you. Let's talk a little bit more about the flu shot, actually. Does the flu shot protect you from COVID-19 or a cold?
So the flu shot protects you against the flu. However, because you are getting that protection against the flu, it is decreasing your likelihood of, say, having a severe complications, which could lead to a decreased immunity and getting COVID-19. So it's not going to necessarily give you protection against COVID-19, but it's definitely going to give you protection against, hey, I'm going to get another infection from the flu or have just decreased immunity overall. So I would still say, please get your flu shot.
Right. Let's talk a little bit more about vaccines. We are getting some specific questions about the COVID vaccine, which we know has been a topic in the news and what we've been discussing too here at MedStar Health. Just specifically to a question that came in from Christine on Facebook. She says, we have compromised health issues and our seniors. How will we know when we can get the vaccine? I know that's a question on everybody's mind.
So we at MedStar are working with our local governments. We're also working with other healthcare partners to basically help to disseminate this throughout the community. It's still an ongoing process. I would suggest that you go to medstarhealth.org.
Mm-hmm.
Because we have the most up-to-date information there.
Mm-hmm.
Also, depending on what jurisdiction you live in, I know the Maryland Department of Health has that information listed, as well as the DC Department of Health. Again, we are at the very early stages of this.
Right.
We have just started distribution. And so right now we are trying, again, working with our partners to get those at highest risk, but a lot of this is literally hour by hour changing.
Exactly. Do we know, this question came from Star, thank you, Star. Do we know if the flu and COVID vaccines are going to interact with each other at all?
So from what I've read from the FDA brief, which is actually available online if everybody wants to actually take a look at that document, there shouldn't be any issue with you taking the flu shot or taking the COVID-19 vaccination. How they're actually produced is very different, and they don't have a lot of cross-reactivity. So again, they wouldn't recommend a vaccine where you could not take something else.
Right.
So that's again why a lot of physicians like myself feel safe in taking the vaccine when it becomes available to us.
Right. Thank you. This is from Morgan, another question about the vaccine. Will the COVID vaccine be needed yearly like the flu shot? Do we have that information at this point?
So this is actually a hot topic right now because we do know, right, for the administration of the 2 vaccines that have been approved, you're going to need one at one point, and then depending on if you receive the Pfizer or the Moderna vaccine, you're going to need something at 21 and 28 days later, again, for the separate 2.
Mm-hmm.
Again, because we're learning a lot about immunity and how it relates to COVID, there is a suspicion that we might have to do a booster like we do every year with the flu shot. But again, this is so new and just rapidly evolving. Mm-hmm. So I don't want to say like, oh, no, we're not going to, but then there may be a chance. So again, right. I would say, if you are concerned, there are some great resources with the CDC, the FDA regarding the vaccine and the process at which it was approved and just what their plans are for it. But I'd also say that we ourselves here at MedStar also do have some information as well, and we'll be developing more information as we get it to help out our patients and the community at large.
Great, thank you. Let's talk about prevention for COVID-19. Can you talk about the proper techniques, masks, hand washing, and social distancing and other preventative measures?
Yeah, so again, when you are having to go out and about, please put on a mask and please wear your mask over properly. Your nose. Mm-hmm. This is where it likes to live. Mm-hmm. Please get over your nose. Yep. The other thing is that hand washing is very important. A lot of times people don't realize how many secretions that you're actually producing throughout the day and how many high touch surfaces. So like doorknobs, remotes, your phone, that while yes, we don't think it lives there for a long period of time, you don't know exactly when that next person is going to come up and touch something that you just touched. So making certain that you wash your hands, making certain that you disinfect high touch surfaces is very important. The other thing is that also, again, when you are out and about or having to go to doctor's appointments or say even within your workspace, you should be trying to distance distance, at least a minimum of 6 feet, because we extrapolate that, you know, the droplet spread is at least that far. So again, we encourage that. But I'd also say another thing about prevention during this time should actually be about how we are treating ourselves, or what we call self-care. A lot of times we don't realize the impact of stress on our immunity. And so a lot of people aren't getting sleep. They're not exercising. You know, they're, while yes, I love sourdough bread, you don't need that much bread. So getting proper nutrition, getting out and exercising. And if you like CrossFit, that's great. Go and do CrossFit. If you, well, depending on what your gym is like. If you want to go on a walk, go on a walk. You need some exercise. You need to release some of that stress. It's going to help out with your immunity. And then the other thing is you need sleep. That's where we kind of regenerate. And if we're not getting good sleep, we're not giving ourselves the best chance to fight things.
Absolutely. Thank you. And we do have more of those resources on our website, medstarhealth.org. And we also have been sharing those resources on our MedStar Health blog, as well as on our social media accounts. So the proper way to wear a mask, we have a wonderful post of our, of Nash wearing his mask properly. And we have some information on our blog as well. So you can always look at that. Thank you for that question and that information, Dr. Mirage.
I have another thing to ask when we were actually talking about kind of preventative things. I would say this is also, even though, yes, it seems very awkward to talk about preventative medicine, this is a great time for people to, if you don't have a primary care provider, to find a primary care provider. Because when you are in those situations where we need somebody in our corner, you're going to have an established relationship with somebody. Also, this is a great time to catch up on some of the things, like if you're overdue for mammograms, if you need a pap smear, if you know you have an issue with diabetes, we want to make certain that these things are still being checked, so that way they're not becoming an issue during this time. And then the other thing is that I just wanted to make certain that people are aware of access points for getting care, not only here, but in general. So here within the MedStar experience, there's primary care providers like myself who are doing telemedicine. So we're doing this on a 9 to 5. And then there is also, you know, depending on what we may see, we may actually ask you to come in, and we have screening protocols for that. We also have 24/7 our MedStar e-visits. So say it's after hours and you're like, man, I've got this really severe kind of sore throat. I don't necessarily want to go to urgent care. I don't think I need to go to the ER. That's a perfect opportunity to speak with a provider through that platform. And that's available on phone, computer, tablet, whatever electronic device that you have. And then, yes, we do have prompt care as well, which is our urgent care facilities. We, again, are trying to use that as more of, you know, you have a discussion with your primary care, and we help to kind of determine where we need to go. And we also do have our hospitals and ERs. But again, I would say that the conversation should really start with your primary care provider, so that way we can make certain you get the appropriate care you need.
Thank you very much. So a lot of different options, a lot of different access points for care. I think the big piece of advice is to have a discussion with a clinician and a primary care provider, so you can get the best advice and you can determine what to do if you're not feeling well. I have a couple more questions for you from our viewers. Thank you for these questions. A little bit more about COVID-19 and how long it lasts. This is a question from Kathy. Can you have a mild case of COVID-19 that lingers on for say 2 to 3 weeks?
So yes, so we have seen, and from a lot of clinical cases, that usually it's anywhere from 7 to 25 days that people can actually still have symptoms. Now, there are people, unfortunately, that may still have like shortness of breath a little bit longer than that. But in terms of like the bulk of your symptoms, so having fevers and chills and the fatigue, that's usually around 7 to 25 days.
Okay, thank you very much. Another question about COVID-19 specifically. We know that there's the MD alert in Maryland and there's a DC alert system. If you are perhaps potentially through contact tracing, you've been exposed to someone with COVID-19, you get an alert on your phone if you've signed up, which is definitely recommended to do that. This question came from Francine. If you have that app and it does alert you that you've may have been exposed to someone who tested positive, do you quarantine even if you haven't even just had a conversation with anyone, maybe when you run and just go to the store?
So I would actually bring that question back to your primary care provider, because oftentimes, yes, you can walk into that 7-Eleven and then the alert is going off. Or I've had a few patients of mine who have received that alert and they were panicked because they were just like, I don't know what's going on. So that's really an opportunity to talk with the provider. Because yes, there are some times when, yeah, you probably should be quarantining, but we want to make certain that we're doing this in a logical fashion. So I'd say call your primary care provider. Let's talk.
Okay, great. One more question from our audience. This is from Shelley. Should patients with food allergies or allergies to medication get the vaccine? I think she's specifically talking about the COVID-19 vaccine.
Yes.
And maybe in the flu vaccine, I would think that they would apply.
Yeah. So in the past, we used to kind of recommend against the flu vaccine for people with egg allergies, but the newer vaccines actually take that off the table. So people with food allergies can safely get the vaccine. And again, they have tried to manufacture this vaccine so that the widest amount of people can get the vaccine. So yes, I would recommend it.
Okay, thank you. One more vaccine question actually from Aaron. Does the pneumonia vaccine help protect people who get COVID? I'm not familiar with the pneumonia vaccine.
So yes, I love this question. So yes, so the big thing that we worry about with the flu and to some extent COVID-19 is development of pneumonia, bacterial pneumonia in particular. So getting the pneumonia vaccine for those who are highest risk. So I'm talking about people who have diabetes, people who are over the age of 65. We want you to get vaccinated against pneumonia as well. So I should be actually saying, get the flu shot. And if you are at risk, get your pneumonia vaccine series as well. Because yes, it's going to help out. Pneumonia is no joke, and we want to give you that protection.
Wonderful, thank you. We have one final question for you. And this is also on a lot of everyone's minds, especially we're in the holiday season. What advice do you have on how people can handle the upcoming holiday season and wanting to spend it with family?
So I would really take stock of kind of your personal situation. Are you at risk for development of complications if you were to have the flu or COVID? You know, are you going to have to travel? What is the means that you're going to have to travel? And if it seems like it may be very burdensome or it puts you at higher risk, I would actually advise that we stay home. I know that that feels just abnormal, but these are different type of times. And I'd say right now, most people are going to understand if you say, look, I have diabetes and I just don't feel comfortable getting on the airplane and flying right now. I think they're gonna get that. There are other ways that we can connect via like things like this, like Zoom or Facebook. My family, we actually every week do a like a family game night because I can't go and see my parents or my in-laws because they are higher risk and of what I do. And so it's a great way for us to continue to still have that family bond, but to protect my important family members.
That's very nice. I love that. That's all the questions that we have for you, Dr. Mirage. Anything else before we wrap up our broadcast today that you want to share with our viewers?
So again, if nothing you take away from today's conversation,
get your flu shot.
Get your flu shot. Primary care is here for you. Again, telemedicine, in-person visits after screening. We have our e-visits, our MedStar Health e-visit. And yes, if needed, we do have our prompt care centers.
Wonderful. Thank you so much. And we will provide a link for everyone so they can access all of those different options and learn more about them in the comments. So thanks again to everyone for joining. Thank you so much, Dr. Mirage. I know that you are a very, very, very busy person, and we just really appreciate you taking the time to educate our community. I know it's a very important topic and something on everyone's minds, and I know that you provided a lot of great advice and education for everyone today. So thank you, thank you. Happy holidays to you and your family. Happy holidays to everyone who watched today, and stay safe. Thank you.
You too. Thank you for allowing me this opportunity.
Of course.